as the title here indicates, it's about applying for health and social care funding, research priorities for the National Institute of Health Research. And the session will be led by Dr. Anastasiya Kichigina, who is Senior Research Program Management at the National Institute of Health Research, and she's also a Senior Lecturer in Public Policy and Health, London Met. Her presentation then will be followed by Duncan Stewart, who is also a grant holder of the National Institute of Health Research, and will provide some information about sort of the detailed research project and data management plan. And then it will be followed by me, who I'm going to be just discussing some of the reviewers' perspective in assessing this type of research and collaboration applications. So we are recording this session, okay? So Anastasia, the floor is yours, please.
Thank you very much, participants. Good evening once again, and I'm very happy to be here with you. And I'm going to talk about strategic priorities for health and social care funding from perspective of the National Institute for Health Research, which is a part of the Department for Health and Social Care, UK government. I'm also going to provide you with different examples of projects which we support and we expect to fund in upcoming years. And I will provide you with some examples how NIHR can support you in development of different proposals and what type of support you can get from our Research Design Center. This is what is going to happen today. So firstly, I'm going to talk about 7 strategic priorities which we fund, and I could see among your subject matters which you just popped up in our chat, but we actually fund research related to all of these subjects which you mentioned in the chat box. I will provide 2 examples of 2 specific programs which I think the most applicable to London Metropolitan University. One of them is a bigger grant proposal, another one is smaller one, but I will mention about the other programs as well, so you can find the information about it on our website. I will give you some tips and will tell you what do you need to know in order to start the development of proposal, and how to build the collaborative partnership should you wish to apply for funding for the NIHR. And at the very end, I will emphasize the importance of public or in-patient involvement and engagement in any application which we seek from researchers and the other public members. So what I would like to tell you is that the NIHR encourages applications using different diverse methods and approaches. And NIHR priorities at the moment have 7 areas of strategic focus. And these are the areas where we need to work with urgency and fundamentally in different ways to address change, to address the challenges and needs and community needs. So at the moment, one of the strategic priorities for the NIHR, as I can see on the slide, are patients with multiple and long-term conditions through all our projects which we have at the moment. This type of category of people related not only to patients with multiple and long-term conditions, and we are talking here about patients who have 2 or more diseases in one person diagnosed. Plus, it is related to social care provision of these people and reaching the communities who have these challenges with health and social care users as well. Also, there are some other strategic priorities which are related to public health and social care research. At the moment, an NIHR priority is looking for the application where public health specialists work together with social care research specialists and members of public, such as patients, public representatives from advocacy groups, representatives from charity organizations, members of public, patients with different conditions, and we apply together in one application by looking for some of the evidences, either for policy research makers on specific research question or questions related to particular cluster of disease. The context of the research at the moment at NIHR, we actually fund the research which is related to the benefits of patients, service users, and communities. There are some other public and charity and funding bodies in the UK, and they fund not only these priorities, but also animal research, for example. Our funding body in NIHR is only related to patient and service users and communities benefits. So make sure that your application which you propose highlights these benefits for these groups of individuals. At the moment, the NIHR is trying to increase the variety of different applications, developing and testing complex intervention, which is a strategic direction of the NIHR, and we are trying to push all our applicants to think differently, to think outside the box, and encourage the number of applicants who never applied for NIHR funding in the past. And we encourage not only academics, but also social care applicants among our applications. We also encourage any other professional specialists, such as pharmacists, for example, to work together with academics and apply. The type of complicated health-related problems we see these days are unlikely to be solved by one type of research methods. So we need a range of research methods to tackle different bits of different problems. What does it mean, more diverse proposals for the NIHR? The NIHR recently refreshed the guidance for applicants to make them more friendly for researchers from different backgrounds, and particularly from the backgrounds of social care. And since 2019, the NIHR is trying to reach the research community who traditionally haven't applied for the funding. London Metropolitan University is not very well presented among the rest of the applicants who we have at the moment among funding project. So the NIHR targeted geographical areas and institutions where we knew that we would get a few applications maybe from, and where we didn't have the committee members yet as well. So we encourage diverse proposal, and particularly from your institution as well. What are the examples which I can provide to you? You can see on the slide, and these are just examples of the type of research programs which we funded, and I allocated my presentation on a shared Google Drive, which is available for academics from London Metropolitan University. So each of these links in blue, highlighted in blue, is the link to actual program, and if you click on it at home after my presentation, you will be able to read what does it mean diverse proposal by using a real example from different projects which we already funded. In 2022, we are seeking new calls, and we already announced some of them for proposal which use very diverse, innovative methodological approach. Some of the applicants are using health observational data to deliver their outcomes in the application, which are available from different data providers across the United Kingdom, and you can access them via UK Biobank, for example, clinical patients record data, sale data set, etc. But some of the researchers deliver their outcomes with primary data collection, which is also great, and we accept these applications as well. Some of the researchers are looking at the social care variables available example, from providers of social care, which is also welcoming from the NIHR. Particularly, we are interested in different variables which you can obtain from care homes. Either it is related to prevention, treatment, service which care homes provide, nutrition, anything related to the variables of social care or healthcare service. Applicants are using also different methodology for the application, and there are new calls which we recently announced and we are particularly promoting it at the moment, which is related to our strategic priorities. These are calls related to patients with multiple and long-term conditions. Particularly, we are wanting to see the innovative different approaches, and applicants maybe who wouldn't have thought even applying for funding before would start thinking and applying to us, and we will be willing to give funding to new applicants. Next slide. So one of the priorities in multiple and long-term conditions for NHR is because it is such an important area for health and social care at the moment. And this is a strategic priority not only for the NHR, but for the other funders as well in the UK and across the world. The NHR has published a strategic framework in this space, and the link I provide also in my presentation, so you can have a look at this at home. The applicants, the applicants and applications which we are looking at the proposal would be tackling these multiple and long-term condition challenges, risk of developing new conditions with age, improvement of social care for patients with these conditions, and also we are looking for different applications which will be addressed to different aspects of this MLTC application, which will be probably addressing a variety of different methodological aspects across the portfolio of application, and it will be highly desirable and welcoming by the NIHR. So a number of NIHR funding programs are available for you to apply. They are all different in terms of time scale for application, the duration of a program you can apply for, the budget you can apply for, and requirements for collaborative partnership. What kind of programs do we have at NIHR? In order to look at all of them, it probably will take a lot of time of our seminar. So I decided I would rather provide some of the NIHR funding streams. Each of these streams have particular programs and particular funding calls. You can find specific program in our page, NIHR page, and you can find the requirement for the funding. All of these programs have calls sometimes 3 or 4 times per year. We are seeking the applications from our applicants. So you will always have time to think about it and maybe to apply not in this call but in the next call, because the purpose of the call is usually remaining for some period of time. Only small aspects of it we can change from round to round during the year. So the list of programs are here on the slide for you, and I'm now moving forward towards one of the examples just for you to have a look at. It is program grants for applied research, and later I will be looking at the policy research program example. So this type of program probably would be interesting and would be exciting for you. Firstly, it has to be a collaborative research, and academics are encouraged to have different co-applicants and co-leads in their programs. For example, you can be a leading applicant for this program, and you can have a co-lead applicant from non-governmental organization, charity organization, pharmaceutical industry, etc. And also you can have a co-applicant, for example, from local authority representatives or social care providers, organizations. And we would like to see in one application with researchers from different subjects. For example, medical sociology, social work, public policy, clinical psychology, biologists, epidemiologists, pharmacists. They work together to address one complex research question. It is important for us to see that all applications which we are looking at have a very clear research question, and all work packages which you have in your applications are very well linked to this research question, and each of the work packages are linked together. Sometimes we see applications where academics do not pay attention on that, and we can see that we can try to accommodate quite a few projects in one application which may exist separately, well, one from another. And in such a case, committee usually say to academic applicant, well, you have to completely reshape your proposal and build your logic going from the research question and evidences which you're going to produce. And perhaps your application could be split up into few projects. So make sure that your project is one whole piece where everything is linked together with research question, aim and objective, and all the data you are using and collecting and evidences which you are producing, they are all related, and one cannot exist without another. Otherwise, academics can see in a committee and cut one of your two even work packages, or sometimes reject the whole application. So make sure that your research will make a difference for patients and service users. And we are very keen to push different methodological approaches in the application. We are very welcoming a few work packages, particularly dedicated to the methodological approaches which tackle methodological challenge as well. For example, proof of concept study. These work packages are very welcome in our applications. What to include to your application for funding? Think about broader perspective. For example, outcomes which you can deliver to the public health, which could be measured at the population level, or it could be measured at the individual level. I would like you maybe to think about novel targets, either it is physical activities, psychological, behavioral change, or nutrition. We see very little proposals looking at the novel targets. For example, nutrition away aside from diet. For example, recent research shows that outcomes of COVID-19 can be varied depending on the nutrition status of a person. So think differently and reach out to the community that we do not see very often in the grant application, and we want our research to tackle health equalities. So all our grant applications require to complete this section of health equalities, and we would like to see how you are going to reach these groups of population, underrepresented groups of the population, and address health inequalities in your research. We also would like to see in the application the description of how you are going to achieve this and how you will make sure that you are achieving this. We would like to see the research which includes the big proportion of eligible population rather than multi-center studies where recruit only 2% of eligible population. So think about it. If we are going to reach these people, then we have to be serious about it. And of course, it must mean that we involve patients and the public, carers and family members right from the beginning of the research design. So once you only start thinking about your research question, you already need to have with you and engage with those groups of people who are your research audience. For example, if it is research about multiple and long-term conditions, that means you need to have in your research group a patient with these conditions. If it is research to improve a social care service, that means you need to include service care user, family member or carer of such a person who receives this service, etc. What are the examples of the research which we anticipate in upcoming funding? You can see on the slide I provided to you some of the anticipated upcoming funding areas for the application, but I do not want you to think that this is a recipe that you need to follow. These are just examples, but if you want to do something else which is not illustrated here on the slide, it is also great. Try to start development of your proposal and do not feel that you have to be constrained by by those examples. Again, I will not read this out today. You have the slides and you can consider it more carefully later. Key features are patience, social care service users, and centered approach. And it would be great maybe if you make a good use of existing data sets which already exist in the United Kingdom, using this to identify targets and develop preventative strategies. We would really welcome application where you would include children, for example, with multiple and long-term conditions, young adults, or any other different age groups. So we know that people with severe mental health problems quite often have physical problems and other conditions that get undertreated. And we are interested in consequences beyond the individual that suffer from multiple and long-term conditions. And we know that none of us live in isolation. And people who have this multiple and long-term condition can be a burden for a family and can be difficult for carers as well, for employers even to know how to help people to stay at work with such conditions. And the last point, maybe just to reinforce that we particularly want in the proposal, which bring new people to the research. And whether they are professional groups or patients or representatives of the public, we would like to see that your research is driven by them, but not vice versa. What does it mean? Research driven by patients means that they play a very significant part in the design of the research, and they are heavily involved in each of your work packages, delivery of your research, analysis of data. So you need to hear their voice and make sure that they are in your research group and your governance structure, and you need to demonstrate to the funder that they participate in each of your work packages. So we want you to work with these people together and to think that outcomes are really important for them. It has to be a research designed together with them, with service users, with patients or members of public. Let's move forward to the next slide. So what are the outcomes which we anticipate from your research proposal? For example, multiple and long-term condition is a very complex field which is a strategic priority for the NHR. So it is unlikely that we are going to use a one single measure for the outcome. So it would be good to read the updated guidelines from Medical Research Council about evaluating of complex interventions. And I provided the link to these guidelines by the end of my slide as well. So someone could join a bit later. You can have my presentation on a shared drive. So the point is that we need to move beyond the measurement of clinical effectiveness only. It is really hard to show that complex interventions demonstrate effectiveness measured by one outcome measure, one questionnaire, or measure at one point of time. So MLTC, multiple long-term conditions, or multimorbidity as we call it in epidemiological subjects, are complex issues. So think about outcome measurements carefully. They need to be linked either to health or to social care service, or to both of them. It could be linked to well-being, it could be linked to improving of quality of life of these patients in some way. And it would be better to involve your stakeholders at the early stage of the design of your research proposal to discuss this outcome of measures with them. How to do it? You simply can ask question when you talk to the members of publics. For example, what would you need to happen to encourage you to change your behavior? Either it is nutrition, for example, or tobacco consumption or alcohol consumption. If you are talking to policymakers and your research is related to policy research, you need to ask what would you need to see from this research program in order for you to commission this service in the future. And it would be better to use quantitative and qualitative measures together in your research proposal, in your measuring outcomes proposal. If you have different work packages in your research program, it is possible that you may have different type of measurements for each of those packages. And it is brilliant as well. We will be welcoming that, but make sure that these work packages are very well linked together with the whole outcome related to your research aim. And let's move forward. There is a fantastic information here with links which you can click, and it can help you to build your proposal. Some of these sources are related to results of focus groups or workshops which we had with different type of communities, with different age groups of service users and patients. For example, if you click on any of it, what do young people with multiple long-term conditions and carers of children with complex care needs think about important areas of research, you can find a lot of insights from these focus groups, which you can, one of them you can address in your proposal, for example. Now I'm moving forward to another example of proposal which might be of your interest as well. This is an example of a policy research program, which is one of the biggest programs at the NIHR and one of the longest in terms of duration. At the moment we have around 31 which we are running this year. The NIHR supports the entire policy development cycle and welcoming policy research proposal related to different age groups, different type of social care service improvement, evaluation of social care service, evaluation of policies, etc. The only thing what we are thinking is important in this proposal. These proposals are usually have a very short duration of time because the evidence have to reach the right people at the right time. For that, we have 1 year application proposal. So you will have 1 year to develop your evidences and to provide these evidences to policy research makers. And in this regard, we usually fund a lot more proposals, for example, than in previous program, because previous program I was explaining just a minute ago was related to collaborative research and complex needs of multiple and long-term conditions, as an example which I used, and it is for up to 3-4 years usually, and the budget is from 1.5 million up to 4 million, for example. And this policy research program has smaller duration in terms of period of time, 1 year, and the budget which we anticipate to see in the application is up to £150,000. So we can see applications sometimes of £30,000, £25,000 for year, or a little bit more. So this actually a very good opportunity for you to explore because it has actually, it doesn't require you to have a big collaborative partnership, although it is still required to have in your application co-applicants as members of public social care service users or patients. So what type of research do we support in this program? We are covering completely different areas, as you can see on the slide, across the whole entire policy development cycle. So PRP could be related to systematic reviews, your proposal could be related to evaluation of different policies, modeling research, economic evaluation, etc. And I have provided some of examples of previous PRP calls which happened recently, so you can find the titles. And the NIHR is also great that they publish usually all the projects which they funded. So you can find minutes from each of this round of your interest, and you can find what exactly was funded to who, and you maybe can find this information about each of these projects on their domestic university site as well, because NIHR has to be accountable in front of the public because we are using taxpayers' money for our funding. That's why a lot of information is already available for you in the public domain. So what are the policy research units you can think about when you apply for policy research funding? They are also on the slide, and they are related to the subject matters which we have at our institution, London Metropolitan. I can see that We have lots of specialists from the pharmacy, we have policy researchers, we have medical sociologists, specialists in health inequalities, nutritionists, etc. We have such a big pool of clinicians, clinical psychologists, for example. We have links with NHS Trust. So think about the area you are interested in, either it is social care research, policy research, or it is public health research, and start looking at the applications which are funded, and maybe it will bring you with an idea of how to apply in your own application. How to make the application for policy research program stronger, and what we will be looking at in your proposal. There are some of the questions which I allocated on the slide, which we are trying to seek in your application. So it would be likely that we will require in our guidance, whatever round of call it is, to answer all of these questions and to think, even if your research funded for 1 year, for smaller period of time with a smaller budget, would it be relevant in 2-3 years time, for example? For who it will be relevant? This what you need to ask yourself as well. What makes a strong peer-to-peer application and what the funding committee will be looking at? It is firstly, of course, relevance of a proposed research to the research specification. Policymakers are usually observants of our funding committee, so they will be looking at your application at the first instance. We usually have no less than 4 public members who will be either service users or patients which your proposal will be related to. So they will be assessing your application as well. And together, of course, with subject matters experts, they will be looking at your application. They will be looking at the quality of your research design, quality of your work plan, feasibility of your research in 1 year, impact of proposed work on specific group of audience, involvement, etc. So here you can see on the slide some of the examples of recently funded policy research program projects. I only provided the titles of that. If you would like to have the details, just to have a look what was the aim objective of this research, what was the methodology, you can contact me out of these seminars because you might be interested in something particular, and I certainly will provide you a consultation about specific proposal or subject area. So where to find collaborators and how can an HR support you to build your collaborative partnership either for small or for big application? Firstly, you need to think about your own capacity building within the institution, London Metropolitan University, and you need to look around and try to find some partners who can participate in your research. It might be someone from School of Social Professions and Sciences. It might be even someone from Human Sciences or Life Sciences, because some of the laboratory, pharmacy specialists are out of our school, but you can collaborate with them as well. You can collaborate with data scientists, for example, etc. London Med has a lot of expertise in it, a lot of links. So think about the links with communities, charity organizations, industries such as, for example, pharmaceutical companies or companies who produce devices for different patients and social care users. NHS Trust could be your partnership organization. At the moment, we see more and more applications where one of the applicant, a lead applicant, is academic, and another co-applicant is a representative either from NHS Trust or charity organization or local authority or patients advocacy group, and we apply together as a co-leading team, plus we have co-applicants, either academics or representatives from these organizations. Local authorities also, as the social care providers, could be your partners or co-applicants. We will welcome it as well. So what else I would like to mention here? If you would check the NHR website and think about the proposal to get funding, you would find a lot of supporting events for you. NHR for free provides workshops, sandpit events where they seek different proposals from different groups of people, looking at them, giving them advice and feedback during these sandpit events. And the best proposals they sometimes directly take to the stage 2 application if proposal is already good. There are some research proposal retreats which you can find. I provided to you in my next slide example of social care retreat where you can learn how to develop social care application, for example. We also have at NIHR different stakeholder engagement events, conferences, and in all these events you can find potential collaborative partners, you can find some networking friends, you can find some experienced researchers who are already funded by NIHR or who are seeking funding as well. You maybe can consolidate and apply together, which is quite often happening in our events, and we see joint application at the end of the events. And also another opportunity which can provide you with expertise and better application proposal is to become a reviewer or committee member for one of the programs. For example, if you are an expert in policy research and your area and publications related to that, NIHR would be welcoming you if you drop the email and give a link to your profile, your institutional profile. They will include you to the NIHR database, and whenever new round of application will come, we will approach you by giving you conflict of interest form, and will provide you PDF form of one of the applications which you would need to review. And Yolanda today will tell about her experience as a reviewer. I usually engage colleagues within my school and give their names to administrative staff of NIHR for them to see more and more application and to be familiar what is in there. So then maybe to apply by themselves or to become a funding committee member. And certainly Research Design Center, which provides a lot of support to develop your research proposal and to apply for funding. In our main NIHR website or LinkedIn NIHR page or Twitter, you can find a lot of events which could be applicable for you and to develop your skills for proposals. I just provide the link here for free upcoming events, but there are a lot more which will be related to your subject area. So what type of support you can get from us? You can apply to Research Design Service, and the Research Design Service for free will help you to develop your research idea. This support is free of charge and available to absolutely all applicants who would like to get this support. There are different expertise in this kind of research design service sector, so you can see experts can help you with absolutely anything related to your proposal. They can even help you with links of how to get PPIE representatives as partners in your application. Here is the information about the Research Design Center, and also the information what exactly they can provide you, from advice to design your study to mock interview, etc. So all the aspect of application process support is covered by Research Design Center, and it is for free. What is in the NIHR application? I provided here the structure which will be slightly reviewed and maybe improved in terms of automatic system which we are changing at the moment, but still the content of the application is the same for any research project, because our online application is standard across the program. So we will be asking you the same things depending on the program. We only can add some specific subsections which we are looking at, but mainly all the sections are the same across all the programs that we have. And I think Duncan today will tell you a little bit more about the content of application. Assessment criteria are on the slide. They are generic assessment criteria, and some of the criteria could be added due to the specificity of the program or call. The most important to remember that public and patient involvement has to be properly costed and considered, because it's one of your application parts and will be assessed by specific public members who are very well trained. Here is the example how you can include patients and public representatives to your research, from the design to the implementation pathway, modeling and evaluation. They have to be involved in each part of the research. If you are not sure how to do it, research design service can help you with this. Plus, we are going to have a specific webinar later, probably April, May, we will announce about it, where we will be giving you examples about public and patient involvement and engagement and different examples from different proposals as well. So you will learn about it in another webinar should you wish to apply for the NIHR. And thank you very much. I have finished and happy to hear your questions.
Thank you, Anastasia. That was very detailed and very good presentation. Lot of information, plus you have kindly circulated many more documents, I believe. I didn't open it yet, but for what you said, there are many interesting, informative links related to your presentation as well. It's in the chat box. And people can, the audience, if you would like to ask any questions, we sort of divided the three presentations to have the opportunity. Please use your mic, or you can type a question if you would like.
Chile?
Yes. Firstly, Anastasia, thank you for the presentation. And, personally, as somebody who's currently writing a proposal and trying to grapple with the presentation and key aspects that the proposal should contain, I am very encouraged that some of the key elements that I've included in the draft proposal, you've cited them in terms of patients and carer participation and the drive for co-production. So I really found that very helpful and encouraging. And also some of the key areas of interest, like in health inequalities, mental health, are the areas that I'm particularly will be interested in engaging with.
Yeah, well, mental health is one of the biggest clusters of diseases we are looking at in terms of proposal, Tele, and we would be very happy to see any proposal related to either mental health as patients or service which is provided to mental health, or maybe evaluation of policy related to mental health, for example, also would be useful. And about inclusion of service users and patients to either policy research or any other research programs, I would like to tell you that our applicants are very creative. Some of them, they have a co-applicant who is a public member, but this public member has links with different communities. Sometimes they link communities with different underrepresented areas, for example, migrants, refugees, different ethnic minorities, etc. And successful applicants are usually those who touch as many underrepresented group as they can. Sometimes they even have in their application a dashboard or a panel of public members or service users from different age groups who participate in implementation of what they do in the design. And if we look at the spectrum of age groups, they include all of these specific age groups in terms of proposal already, so they include them as co-applicants. Sometimes they include carers as well, carers from family member who have experience of this service which they provide, or caring which they provide to their family member. And also, if you are going to apply for an NIHR, try to articulate clearly your pathway, how this research question and the aim became patients or service users driven. For example, applicants usually say in the application initially, we were thinking about this research proposal, but when we started to design it and include it with patients, we started to discuss with them more and more, and we reshaped our research proposal, which is now this, because they said, for example, instead of counting multiple and long-term conditions, it would be rather better to weight each single condition, because condition number 5 causes more problem for me than condition number 2. And patient with one multiple conditions, for example, number will be very different from another, because the burden is different on each individual. So the applicants sometimes show us we decided to come to new methodological approach, such as burdensomeness of this condition. And we came to it only because we had these patients who are working in our group.
Okay, thank you, Telly and Anastasia. I think there are some comments in the chat. Anastasia, you would like to refer to?
Yeah, I can see Diana say about local authorities. I have seen some initiatives already of joint bids. Yes, including joint bids. Yes. What, Diana, I would like to tell you, local authorities are usually providers of social care. And at the moment, the data which we have in the United Kingdom about this service provision is either in the organizations who provide social care or in local authorities. At the moment, we do not have any unique data sets which would be applicable for this service provision across the United Kingdom. And NHR priority is actually to seek more and more applications where it will be a joint proposal with local authority, because we would like to see how to use these variables for research policymakers, how to provide evidences, because health research is very well established in terms of data sets. For example, applicants are using UK Biobank or clinical patients record data where you can already get this data. Social care variables is something different. We don't have too much research about it. We even don't know which variables we need to look at by addressing different questions. So this area is quite brand new. So this is a very high topic now for NHR, and these applications are on top, I would say.
Okay. So I think, thanks, Anastasia. I think we are moving now to the other part of the session, and if anyone had any further question, please type it in the chat box, and we'll come back to that at the end. Duncan, if you are ready, you want me to upload your slides? Or...
Yes, please, if you don't mind.
Yes, I can do that.
Splendid, thanks, Yolanda. Right, I'm going to keep this brief. First of all, thank you, Anastasia. Well, we're very lucky to have her in the university, and we should exploit her ruthlessly, because she's got the inside track into what's going on in NIHR, which is brilliant for us. So thank you for sharing all that, Anastasia, and I hope you don't mind if we, myself and colleagues, approach you for advice in the course of our research applications from this point. None of the content I'm going to show you is actually original, but every call for either research-led or specific projects that NIHR asks for applications for, they give very detailed guidance for applicants. And you really must just follow that as closely as you can, because it's actually very detailed, but very good. But I'm just going to flag up a few things. So these are the things highlighted in red. I'm just going to give a little bit of an overview of those, just to give you a flavour of not so much what you write, but think about this as an application process. So the things you need to be thinking of in advance of preparing an application. And of course, you need to express that as clearly as you can when it comes to writing it down. So the first thing, what is the problem being addressed? Which more bluntly put could be, what's the point of your study? You know, you really need to have a very clear rationale for doing it in the first place. So that means a crystal clear explanation of the specific health or social care problem to be addressed. And that should be articulated in the context of how it affects patients, carers, or health systems, and what this research, your research, is going to provide us in terms of new knowledge. Now you will have to frame that in the context of the aims and objectives of the specific calls and programs that Anastasiya showed you. The range of NIHR programs all do slightly different things, and you'll have to show how your study, your research, fits the aims and objectives of that specific program. And really, this is just the start of telling the story. Think about it like that, telling the story of why we need to be doing this research. And it has to be expressed in a way that non-specialists can understand. So you might be a social scientist, for example, but your application might be read by someone with a dentistry background. You know, the applications go to all sorts of reviewers and panel members, and it needs to be understood by you know, every kind of professional background you can imagine. So it does need to be very clearly written. Now, most of the calls will ask you to specify why your research is important, and they'll do this in a number of ways. They might actually give you guidance like this in some form or other, but it really needs to be clear about what the needs are for the research. So needs in terms of the benefits from improving health or health services. If there's any express need, in other words, is there evidence out there that actually this research is needed? So that might come from recommendations from particular policy documents or health practice guidelines. Is there a call for your kind of study out there that you can draw on to show actually we do need this study because such and such guidance tells us that this is an evidence gap that needs filling? You know, is this going to be a topic or an issue that's going to have sustained interest? You know, is it actually going to contribute to the NHS in the longer term? So it's not just a flash in the pan study. Exactly how are you going to generate new knowledge? You might have already said, well, we're going to fill a knowledge gap, but you need to say, well, how is it going to do that? And to what extent do the findings generalize to other aspects of the NHS and social care? You know, what other lessons might be learned for perhaps, you know, clinical areas that might be different to the one that you're studying for your project? And how this builds on existing work, that might be your own or other people's, but the important thing is that you're not duplicating what's already been done. And on that topic, NIHR will not fund anything that is not grounded in some form of systematic review. So there needs to be clear evidence that from primary research that informs your proposed study, and I think they're probably particularly concerned about significant overlaps between your proposal and what's gone before. So that means you know, if there are existing systematic reviews, you can draw on those, and obviously recent ones are perfect. So you can say, well, you know, blogs et al. Have done this review, so we think this study is needed because of X, Y, and Z, or it's informed the design of the study in some way. But if such reviews do not exist, you must do one yourself. And that means searching the literature using a systematic review methodology, and you will need to give some general parameters for how you've done that in your application, and then you will need to sort of summarize the conclusions of that in the context of why the literature supports your research idea. And finally, going back to public and patient involvement, so Anastasia's flagged up how important that is, that it's actually embedded in the application. It's not an add-on, and it's also embedded in the process of developing the application. So, you know, from NIHR's perspective, research is not something we do to people. Research is something we do with people, and they need to be involved at every stage, and that includes the planning and the development of the research application. So you know, when you're thinking about an NIHR application, one of the first things you should think about is how to involve patients in that process, or the public or carers, you know, in that process, service users. Because in the application, you're going to have to describe who's been involved and when, and specifically what did you consult with public and the patients about? What were their conclusions, and how did that shape or contribute to the proposal? And you have to give specific examples. You know, we talked about the content of our proposed intervention with our patient group, and they suggested XYZ changes, and so we've developed it in such a way. So really clear evidence that patients have contributed to the design of the research. And you have to say how that's benefited, how how their contributions have benefited the science and the content of the proposal. And then you have to describe how involvement will continue throughout the project. And it really is important that that is like a central element of the project. So you will have to have a group, a PPI group. You might want to think about having a lay co-applicant or two, so people who are sharing the responsibility of doing and managing the research, and all that will have to be appropriately costed. So we're going to run a seminar specifically on PPI and how to do it in the near future. But for the moment, the take-home message is that this must be part of the very early planning of any application to NIHR. So I'm going to end there. You might have a minute or two for brief questions before handing on to Yolanda.
I do have a quick question, a burning question, I will say, Duncan, because one of the issues you mentioned is about the literature review or the systematic review. Can you hear me?
Yeah, I can. Yeah, go on.
Sorry. I've seen some applications whereby they include in the application package to have a systematic or any other type of review well. So is it, I understand the need of evidence, of course, so you explained that very well. But the question is that for all type of applications that you need to have done a systematic review if it doesn't exist one before the application, or can you include that systematic review within your application as something to be developed?
I think you can include reviews in bigger projects, bigger programs of research, so program grants, for example. You could include a review. The other exception would be where there's a very specific call on a topic, in which case the review would have already been done to inform the specification for the study. So you wouldn't need to do that. But by and large, you do need to show what we already know about your topic, and NIHR would expect you to have done that following systematic review methodology, just to be sure that it's as comprehensive as it can be.
Even if it is not published?
Oh yeah, if
you
it's
do
not
it.
you can say, well, look,
okay.
these are the search terms
Okay.
we use. We looked at such and such databases, you know, and you could even put that in an appendix, but you would have to show that you've done some kind of systematic review of the, yeah. I mean, fingers crossed, there are existing ones that you can draw on, and that makes the task an awful lot easier.
Thank you. Don't know if we have any further questions. Again, we can continue with further questions if you would prefer after my presentation, if that's okay. Just double check on the chat. There is a message from Anastasia saying, addressing the question from Telly. Okay, for Telly, there is a link there about mental health funding. Well, thank you, Duncan. I mean, that's clearly the core of the issues that you're presenting here about things to bear in mind when putting an application together. And I should say there's a lot of thinking around this because just moving swiftly with my part of the presentation, which is the reviewer perspective on this type of applications, some insight to the review process and the many aspects that reviewers are asked to consider when evaluating grant applications for the NIHR. They have a set form to provide their assessment, and this criteria is quite common or similar to other funders, especially of large bids like the Wellcome Trust, the interdisciplinary grants, for example, which also require this sort of same set of content. And I'm trying to bring my slides just to, I think it's there. I think Anastasia presented already on these criteria. She mentioned sort of the headlines, and I'm not going to go through each of them. But the relevance of the proposal, proposed research to the research specification, that is the research brief, quality of the research design, quality of the work plan and proposed management arrangements, strength of the collaboration, leadership and research team, impact of the proposed work, value for money, and patient and public involvement. Now, each of these sort of criteria, or each criterion, will lead to a set of questions, and I have sort of selected a handful of those, 3 of them. The first one is relevance of the proposed research to the research specification. And here you have sort of a list of questions that reviewers are asked to comment on. The first one, number 1, you see there how relevant the proposal is in relation to the research brief. And here you have some, obviously some nudging, if you like. For example, the strategic objectives of the call. And examples are capacity and capability development, considerations of health inequalities and PPI, methodological development. I think that obviously the patient and public involvement is paramount, as Duncan was saying, for which is also a separate criterion that you saw in the list, the last one, for reviewers to comment on. But you can see that here are featuring again, and this implies obviously for those preparing the bid, time dedicated to building that patient group before starting the work, the proposal, as they should be consulting in at the design stage, and then carefully planning the patient and public group with clear management plan as well. That is also required. The development of new methodologies, I think that Anastasia mentioned on that, is attention to novel approaches, to research designs, to data collection and use of existing data and data repositories, for example. And the issue of health qualities, All research funded by the National Institute of Health Research should contribute to reducing health inequalities, including issues of social class, ethnicity, sex, and other protected groups. And health inequalities manifest at different levels. That is from the choice of your data or the sources that need to be carefully considered. The idea is that you're not exacerbated, you as an applicant, your project is not exacerbated potential bias, yes, that might generate more inequality. So that means the inclusion of underserved groups should be also carefully considered. And there is a link, surely within the sources of that Anastasiya have presented, and otherwise is in the web pages, about which are those groups of people that are more difficult to reach and for which we need to consider in our participation groups or data collection. Well, another question is to what extent that the proposed research add distinct value or advance existing knowledge. And here is a clear focus on the relevant knowledge to be gained through the proposal. And secondly is a focus on health inequalities and the embeddedness, as we were saying before, of the social determinant factors can offer also a point here for added value. Another point is the direct impact on service providers and service users, and how the knowledge gained from this project can form the basis for targeted interventions, for example, if it is not already contemplating within the proposal. The second area I wanted to highlight is the strength of the collaboration, leadership and research team. And here you have another set of questions that reviewers will be answering, and I'd like to draw attention on question number 2. Are the roles of team members clearly described? And question number 3, does the research team provide the necessary breadth and depth of expertise to deliver the proposed work? These two are somehow related, because in question number 2, the idea is about stating how each individual and member of the group will contribute to the research program, and how the expertise, here you need to mention the role of the individual and what exactly contributing to the proposal, should be, I would say, spread along their roles across the different work streams that usually form part of the research project. These are, for example, the collaborative grant type of project. But in any proposal that I suppose have a component of interdisciplinarity, and the roles, I suppose, need to be carefully thought, because the question number 3 is about this necessary breadth and depth. And this is a challenging question because of the somehow, I will say, limited tradition that we have in interdisciplinary research. And many teams tend to work with cognate disciplines. For example, a clinician will work with a statistician or a public health professional, a nurse, and someone, for example, from health informatics. All these disciplines work relatively well together, and the challenge is when incorporating social sciences or the humanities, isn't it? I mean, when you bring disciplines that you're not usually part of your work or what you're usually doing. I mean, it could be education, it could be arts therapy, it could be, I don't know, social sciences on its own. I mean, social studies of science and technology, for example. And I think that the engagement with other more distant, let's say, disciplines should be also carefully thought of, because it is there where there are some weaknesses. I think Anastasiya was mentioning this in her presentation, this patching together approaches to meet the research goal. it should be apparent that all these disciplines that are contributing to the same research questions are really, there are really synergies within them, and the roles, yes, the roles that have been allocated will demonstrate that will contribute to that same research question. How you can incorporate methodologies of other disciplines, but truly incorporating into the findings of the research, I think is important, not as some sort of standalone contribution separate from the main findings. I mean, incorporating findings is a way of saying, well, all the disciplines are being here, are here because are being considered to answer this question. So I think these are some of the tricky things to consider here in this area. And likewise, the depth of expertise in the question above, the question number 2, should be considered, ensuring that the expert of these more distant disciplines are part of the team and not, for example, as I've seen, postdoctoral researchers, for example. You need the same sort of level of expertise across, or a similar level positioning of expertise across all the work streams to make better sense. Question number 4 says, well, have the applicants proposed what they can offer to support the wider network? And this is about consideration of wider networks engagement, sharing of data repositories alongside different institutions, for example, provision of opportunity for training of early career researchers, engaging also mid-career researchers within a new topic. And then it's also about the transfer of methodologies to support others working on the same research area or topic is also important to consider. And the last one, the last slide, it's about the impact of the proposed work. The first question number 1, again, the proposal offers a clear vision of benefits for patients and the health system. Again, here is worth emphasizing how population groups and patients from multi-ethnic or socially deprived areas will benefit from the research, as well as a specific healthcare professional or the NHS. And question number 2, are the necessary clinic, academic, organizational links needed to support the research in place? I think that the last one I reviewed, there were 24 letters of support. Mind you, it was a very large application, with support from different organizations, NHS Trust, agency, from Department of Health, university, etc., to ensure that all that data, all that project could come to fruition, because Anastasia also was mentioning how much we need to engage with charities, with other potential applicants should engage with charities and different organizations, and to ensure sometimes that the data that we are proposing to use is really and truly accessible. And for that, we need that support, those letters of support. Dissemination and stakeholder engagement plans. This is also a very detailed plan of researchers are going to disseminate and reach out to different audiences. That's the proposal outlining credible plans to make data available and share learning with the wider health research community. And here is about publications, open access publication and conference, but also a website, for example, disseminate research findings and public engagement activities, including engagement with professional societies. These are the areas that one could think of using or think ahead of putting the application. And then the last one is credible plans for the implementation of patient and public involvement are this resource. This is specifically about how much sort of the project have considered a budget for implementation of patient and public involvement. Now, you notice that the question of this criterion is about impact of the proposed work, but we do have, or there is another, I mentioned here at the beginning, there is another one specifically that I'm not covering here, patient and public involvement, another criterion dedicated to that. You will notice that many of the questions I went through only in 3 of these criterion for this assessment. You will notice that they are very reiterative. I mean, they you feel as you go through this assessment that you have been there already. And I think that it's the idea is to make you think very well and very carefully whether you have covered or answered a question from very different angles. So I wanted to sort of to flag up these 3 areas because I think that are the ones that are more not external, but are the things that are slightly outside your idea of research. I mean, it's expanding, it's involvement, it's engagement, it's impact, it's relevance, is putting together an interdisciplinary group, and all these things takes a lot of an organization as well, take a lot of time, and takes a lot of careful thinking. And I think I will leave it there, my presentation. And I don't know if we have some questions or comments from the audience.
I don't know, I can just add maybe that it doesn't matter if you are doctor by research degree or you are either principal, lecturer, or you are professor. It doesn't really matter in our application. The most important is the quality application which we receive. And moreover, one of the strategic priorities for the NIHR to fund early career researchers who are coming into the field and to bring the community research of researchers from young generation. So this is what I wanted to highlight. If you're early career researcher and you do not have experience of applying to NIHR, you shouldn't be hesitating to do that because it's not a barrier or challenge for NIHR funding committee. You can have a co-applicant who's more experienced, or you can have a mentor who is more experienced and already managed large collaborative research projects in your application. But we found a lot of young researchers to get the funding. I probably think that the next step would be to go to the School of Human Sciences because they have a lot of technical expertise which could be a good value to add to School of Social Professions, because majority of successful applications which we see and fund, they are successful collaborations within the university between different divisions, departments and faculties. So I think at the university level, it would be good to have an event similar like that, to marry different schools together and to start thinking how to develop proposals by using each other's expertise together in one collaborative application. This is, I think, the key for success.
Thank you. I don't know if you have any further questions. We took a bit of extra time. Duncan, if you'd like to add anything else? Or...
I haven't got anything to add. I think we've been very comprehensive.
Okay. Okay, people saying that will be very useful and early research. I'm sure we'll be in touch to more support and hopefully collaboration in the future. Yes, Dale, I think you mentioned you are in one of the areas of nutrition, isn't it?
Yes.
That Anastasia mentioned that is one of the areas that will be well received, say, as a topic or area of research.
Yes. Yes, nutrition as well. Well, actually, anyone who is here in the audience is welcome. You all topics are welcome, and I think university kind of events where we could make more emphasis on collaborative way of working. But I would like only to add up on that. At the moment, I applied for the job which is head of collaborative partnership. I'm sure maybe someone else applied from school. I think once this vacancy is filled, that person will start working on these collaborative events within the school, between schools, because what is lacking at the moment is these collaborative proposal webinars, sandpit events, we call them in NHR, where people from different subject areas would have a kind of academic date and sitting together and developing proposal by thinking how their expertise can fit to the research question, how we can collaborate together. I don't think we ever done it before between schools, never, I think.
No, well, no. How focusing on a particular sort of, well, no, we haven't done that. I think obviously this funding is targeted to more. I mean, there is a point of health here, obviously, in this National Institute of Health Research funding, but. For example, I'm putting together the program now of the, as we do, of the conference and the interdisciplinary research conference, and there's a lot of crossing. I mean, it's a way of making people think around health and well-being, and from there probably is a good opportunity for people to learn what others are doing and to see those synergies within the School of Social Sciences and Professions. And there's a lot of students from psychology as well, and human sciences, as you said, although they are not part here of this event, but of the conference event. But there are many synergies as well with human sciences, so it's a matter of perhaps offering to people to have another sort of event where we can concentrate on more specific research goals, not necessarily from health, but have health and other disciplines where interdisciplinarity can funding can be applied for. Yes. So I'm looking at the chat. There are some comments from Anna. Where do we need, but not for National Institute of Health Research? We're also part of a large consortium bid across discipline for National Institute of Health Research and IRC. Can you clarify what the last one is? Sorry. The ADIRC. There, or you can use the chat. Okay.
Well, if we're already doing it, we can use Anna's experience and do it for NHR as well.
She said health determinants inequalities. The health determinants inequalities research. Okay, so that is part of the the National Institute of Health Research call for a consortium that believe you passed to the second round of that application. But yeah, I mean, that is something that one of the local authorities, I believe, has been involved, and it's something that probably we can draw on if the full lead is successful. Be a potential area, I suppose, for further work with different disciplines as well. It's actually related to health, to inequalities in health research. Okay, so thank you for that, Anna. That's great. well. We're keen to develop across school beats. Excellent.
Yeah, this is good. I think it's a good step forward for everyone.
Yeah, definitely. Okay, so I think we can draw to a close. If there are no more questions or comments, can you share this slide for future reference? Yes, Henry, we will have this uploaded to. I stop the recording now, by the way. We will have this